Back for another episode, and today I'm thrilled to have with me Melissa Sanchez. Melissa is the Senior Director of Public Policy at the Alzheimer's Association, and she has graciously agreed to take some time to visit with us about the work she and her organization do and an important proposition that's coming up for election in November. So Melissa, with that introduction, first of all, welcome and thank you so much for taking the time to visit with us today.
Thank you for having me, Tom.
Melissa, could you give our audience your professional background and what led you to your current role?
Yeah, sure. So my journey began in law school, where I was drawn to how law shapes people's lives. And following law school, I worked in the immigration law space in New York City. And it was in that experience that I saw how policy decisions make an impact. Decisions that are made in rooms far away and conversations that are had far away make an impact on families that were seen across from me. And that experience sparked something in me, an interest and a commitment to be a part of something bigger. So a part of those decisions, those conversations that we're helping elsewhere, to ensure that the policies reflect the people that they're served or intending to serve. And so that's what drew me to public policy and kind of where I am today, the opportunity to transform lived experiences, firsthand experiences, to drive that broader and lasting change that happens through public policy.
And then what is your current role?
So I'm the Texas Senior Public Policy Director for the Alzheimer's Association, which means that I work with all of our 6 chapters of the Alzheimer's Association across the state and help lead our federal and state policy efforts together with a great team, and then together with our amazing advocates from across the state who use their stories to help drive policy change.
And could you share with us, at least highlight, because we'll take a little bit deeper dive into it later in the podcast, your current initiative around Prop 14?
Yeah, sure. So Proposition 14 is on the ballot for the November 4th, 2025 general election, so just under a month away. And if approved, it would amend the Texas Constitution to transfer $3 billion from the state's general revenue budget over 10 years to support the Dementia Prevention and Research Institute of Texas, which is known as its acronym as DPRIT. And so if approved by voters this November, it will be the largest state-funded research program for dementia in the country. And it's modeled directly off of the very successful Cancer Prevention and Research Institute of Texas, known as CPRIT, so C for cancer, P for dementia. And the DPRIT really has, I think, 3 main objectives. And so the first is to advance research into the causes, treatment, and prevention of neurological diseases like Alzheimer's, dementia, Parkinson's, and to enhance the potential for a medical or scientific breakthrough, but also attract talent and build the infrastructure needed to make Texas a central hub for brain research. So similar again as CPRIT did for Texas, when somebody gets an initial diagnosis of cancer or is seeking a second opinion for cancer, more often than not, the place they think of is Texas, is MD Anderson or Texas Oncology. And so we're hoping that these funds will do the same for dementia, attract leading researchers and physicians to major research centers across the state. And then lastly, it will, I think, foster collaboration between Texas universities, current health systems here in the state, and research institutions through grants for biomedical and neurology research, particularly in underrepresented regions with high prevalence rates like South Texas and West Texas. So one thing I do want to make clear, though, that I think it's important for listeners to hear is that the funds for DPRIT have already been set aside by the Texas legislature. That was done through enabling legislation, which was Senate Bill 5, and it was passed with bipartisan support both in the House and the Senate. And it was a legislative priority for our Texas Lieutenant Governor Dan Patrick. So a yes vote on Proposition 14 will not raise our taxes. It will merely allow the already set aside funds to be dispersed to get DPRIT up and running.
Well, so I'd like to turn now to the Alzheimer's Association. Could you describe the organization? You've talked about your role, but what are some of the key priorities and how does the Alzheimer's Association actually impact families who might be faced with this devastating condition?
Sure. So the Alzheimer's Association is the largest voluntary health organization dealing with dementia. And we have pretty much three kind of pillars, if you will. And the first is care and support. And so that is ensuring that families living with the disease, their care partners or caregivers have access to the tools and resources to navigate through the disease. So that includes support groups. That includes a 24/7 helpline that is available in over 200 languages for persons living with the disease, their caregivers, professionals, healthcare professionals. We have law enforcement that will call it from time to time, saying that they're dealing with a resident who's having maybe a behavioral outbreak due to dementia, and so they need help kind of facilitating that situation. Ensuring that the community is educated and aware of the signs and symptoms, so we're out in the community providing those kinds of resources, direct resources to the community, but also advancing research. We are the largest nonprofit funder of Alzheimer's research, and we focus a lot of our advocacy work in ensuring that caregivers have the care and support that they need, but also on ensuring that our federal and state governments are funding research at the federal level through NIH, at the state level through initiatives like DPRIT, to continue the progress that we've seen in dementia, because we're really in a pivotal point in dementia research where we have new treatments on the market that can slow the progression of the disease. And it's taken us years to get here, but it's taking that continued investment in dementia research to make the progress that we're seeing. And so it's so critical that we continue that momentum. And then lastly is our advocacy, using the stories of our volunteer advocates to drive that policy change, focusing on access to quality care, strengthening the dementia care workforce, so ensuring that professionals have the training and resources that they need to recognize and manage cognitive decline effectively, and then advocating for that support for the caregivers, so through policies such as respite care or ensuring access to care planning and home and community based, so that families can age in their communities in home, which in the end results in long-term savings to the state as well.
So this condition and the others described that you and your colleagues help advocate for are, I think almost every American is aware of them. What are some of the biggest obstacles or roadblocks that your association has in promoting the goals? Is it raising money? Is it people aren't aware? Maybe I've overestimated the awareness. What are some of the challenges you all face?
Yeah, I think you hit on it, Tom, that second one, and that is one of the biggest challenges to advancing particularly Alzheimer's related legislation, is the lack of awareness about the full scope of the disease's impact, both economically and emotionally. And I think too often policymakers and the public even still see Alzheimer's and dementia primarily as a personal or family issue, rather than the public health crisis that it is, that affects every community and every sector of our healthcare system. And I think another major challenge is, and one that is just kind of the reality of the work that we do, is competing priorities and limited funding. So legislators are balancing many urgent needs, and so it's important making that strong, data-driven case for why dementia should remain a top priority requires persistence in coordination and real stories from our volunteer advocates that connect policy to the people in the communities.
You've talked about several things that are really in the public arena. You've talked about healthcare. You just touched on law enforcement. I don't want to dwell on that, but law enforcement is a part of this as well. We also have public health and safety. Can you help us understand why this disease or condition should be at the forefront of the public discussion and not a family issue, as you mentioned a little bit earlier?
Yeah, I think that to elaborate a little bit on that, it's really about the impact, the widespread impact that dementia has on communities. And so again, it extends beyond the person with the disease and their family. It impacts our economy in the sense that you have folks who are caregiving. The caring for a person with dementia is a 24-hour-a-day job. And so folks are being pulled from their places of employment. Their workplace productivity declines. There's research that shows this, that caregivers, their workplace productivity declines. And there's a lot of companies and real work and studies going into this concept of brain health economy, and which really looks at how can we improve the brain health of the workforce. And not just when you think of neurological diseases and dementia, but really how can we make the workspace a healthier place and for employees to flourish, which benefits not just the employee, but also the company and the corporation in increasing their productivity. I think the burden that dementia can have on our healthcare system is incredible. And we're seeing it and we're living it now in Texas with 460,000 Texans living with the disease. Texas has the aging population is growing at a faster rate than the national average in Texas. And so we know that the problem's only going to exacerbate in the coming years. And healthcare systems are being oversaturated. Getting a dementia diagnosis early and accurately is hard to come by in Texas, especially when you think of rural Texas. So a lot of our specialty doctors in the state have wait times that exceed over 200 days. And that 200 days can be the difference between early stages of the disease and middle stages of the disease when someone is no longer eligible for treatments. So the new treatments on the market are only effective in the earliest stages of the disease. And when patients are having to wait 200 days to see a neurologist and get a diagnosis, at that point, it's probably too late for them to get on any of the treatments that can slow the progression of the disease. And our healthcare system is oversaturated. Our primary care physicians, unfortunately, as hard as they're working in medical school, they're not receiving the dementia training that they need to accurately diagnose. And so again, there's lost time in that from when a patient sees their primary care physician to when they see their neurologist. When you think of Medicaid dollars that are spent with emergency room visits and revisits, patients with dementia have higher readmission rates to hospital systems. They go into state-supported long-term care. Spending is increased because we're not managing the disease early enough in the stage process. So all of these things are really costing our state an exorbitant amount of money. And so if we can start addressing Alzheimer's disease now and kind of shift our mentality that we've really addressed it in the state of let's prepare instead of react to Alzheimer's and what's coming down the pipeline. And so it's only a matter of time. If you don't know somebody who has dementia today, you're likely going to meet somebody in the coming years who develops it. And so it's important that we really do address this as a public health crisis and not just as an individual kind of family issue.
Let me turn to the initiative around Prop 14 and how can listeners either support this initiative or maybe even get involved with an organization like yours?
Yeah, absolutely. Yesterday was the last day to vote. Now our next ask is the easiest and best way to support our campaign is to make a plan to vote yes on Proposition 14. Early voting begins Monday, October 20th and runs through Friday, October 31st. If you can't make it out to vote early, make the plan, take 3 of your friends to vote yes on November 4th, Election Day. And then I'd say help spread the word about what Proposition 14 can do for dementia in not just in the state, but really in the country. We could be a leader creating the largest dementia research institute in the country. And for more information, listeners can visit our campaign page at alz.org/yes-on-14. And there's additional information. They can take a pledge, which will then send them reminders about early voting, Election Day, and any kind of campaign updates. So I encourage folks to visit our website, and there's also ways for them to get connected to our volunteer opportunities as well on alz.org.
I'd like to pick up on something you've said a couple of times now. Early on, you talked about how Prop 14, if passed, the funding could help Texas begin to lead the nation in Alzheimer's research along the lines that we currently have at either MD Anderson or other world-class hospitals. And then just now, again, you said that this could give Texas the opportunity to, if not lead the nation, certainly be one of the nation's leaders in Alzheimer's research. Why is that so important for the state of Texas to be a leader in this area?
I think in Texas, it's go big or go home. We like to kind of lead. We're leaders. But I think we oftentimes see in Texas is kind of like a laboratory for a lot of laws and policies that then go on to become national federal legislations. And so I think it's important for us to also bring those specialty doctors to Texas, to bring those experts, the innovation, the innovators, the researchers to Texas. We are one of the biggest states in the country, right? And There's a lot of opportunity here in Texas, but I think just right now in the dementia space, we're still behind some other states. And for instance, Florida, Georgia, some smaller states, Wisconsin, are doing amazing things on the dementia front. And so I think this is really an opportunity for us as a state to step up and to say that this is something that we're taking seriously. This is something that we no longer want to be reactive to. We want to start preparing ourselves for kind of what's to come down the pipeline with our aging population. And I think it helps attract just more additional folks to the state who want to live in a state where they have access to, where they can age in place and have access to care in their rural areas or wherever they want to move to in the state. They don't have to be concerned about how far away am I from a major medical center or from a specialty doctor. So I think it's a win for all of us when Texas is leading, especially in the healthcare space.
Melissa, assuming this legislation passes, are there initiatives down the road that you or your colleagues hope to be able to work on?
Yeah, and I think I touched a little bit on it, but one of the biggest initiatives that we'll be working on as we're preparing for the 2027 legislative session is for the creation of the Texas Memory Net. And this is it's modeled off of similar and successful statewide programs in other states. Like I mentioned, Georgia, Florida, Wisconsin, New York, and California have something similar to this. And it's designed to help address delayed diagnosis, access to care issues, disease management, and care planning. And again, the delayed diagnosis, the impact that it has on the state's budget, I cannot overstate, with unnecessary emergency room visits and early entrance into those state-supported long-term care facilities. And so a memory net would essentially create like a wheel and spoke health model. So it would establish a partnership with a Texas academic and medical institution, which would essentially be like a dementia hub, and then work with community physicians and community organizations to refine patient workflow and provide training and support in dementia diagnosis and management down to kind of the spokes of the wheel, so that folks can be getting dementia care through their primary care physician, and that primary care physician is working together in tandem with an expert at a dementia hub. And so that we're not going 200 days without a diagnosis, and we're giving families and patients the best opportunity to get onto treatments, to participate in clinical trials, and really boost that research pipeline. And so we see this as a great kind of next step to the Dementia Prevention Research Institute of Texas, because together they can create that seamless pipeline from research discoveries in the lab to trained healthcare professionals, and ultimately to patients and families to ensure that they're receiving high quality care statewide.
I live in a county which is 35% over the age of 65. So you're going to be speaking to my people, I should say. But what message would you like to share with families, professionals, and policymakers, or those who maybe simply want to become more knowledgeable about any of the topics we've touched on today?
Yeah, I think we definitely welcome you to visit our website, alz.org, and attend any of our community conversations that we're having. We do research symposiums for the community. We also partner a lot with other community organizations and stakeholders. We're doing a webinar actually tomorrow. It's tomorrow at 2 p.m. Together with the Texas Healthcare and Bioscience Institute and with the Greater Houston Partnership. So again, talk about Alzheimer's research, dementia research, kind of the state of dementia research, and why DPRIT and Proposition 14 are so important. And I think something that I also want to make sure that folks who are just kind of interested, or maybe professionals in this space, is just highlight the importance of that cross-sector collaboration. That's why we're working with GHP, the Greater Houston Partnership, working with other chambers across the state, with Texas Healthcare and Bioscience Institute, because that's cross-collaboration is really where the magic happens when it comes to improving not just dementia care, but healthcare. And our healthcare professionals see firsthand what families and patients are going through. Our, for instance, compliance experts make sure that the systems and safeguards are in place to do that work ethically and responsibly. And then our public policy leaders can take those lessons and turn them into long-term solutions that reach every corner of the state.
Unfortunately, we are near the end of our time for this episode. You've given your website several times already in the pod, but I wanted to put it all at the end. So could you tell us where people can go if they want to find out more or get more involved, and then the social channels that the Alzheimer's Association has?
Sure, absolutely. So you can visit our campaign landing page for voting yes on Proposition 14. It's alz.org/yes on 14. The Alzheimer's Association's website is alz.org, so pretty easy to remember. And then our socials are /tex. I think it's alz/tex is what it is in it. I'm not on social, so I may have, but I know that you have it. So we encourage you all to visit. And right now as Texans, we really have an opportunity to make a difference by voting yes on Prop 14.
Melissa, I want to thank you so much for taking the time to visit with me, and I hope we can continue this conversation.
Thanks so much, Tom. Appreciate it.